I wanna go back to the islands.
Good morning, Jon Clarke, Dr. Dave Campbell here.
Morning.
As you know, I'm a spine surgeon and I'm the chief medical correspondent for a major network, also an associate professor of orthopedic surgery. And I, like you, am a veteran of the United States military. You, Jon Clarke, were an FMF Navy corpsman. You worked at Camp Pendleton in the hospital there where my son, Greg, who's in the military at the time in the Marine Corps, was, and you took care of a lot of Marines during the 5 years you were active duty as a Navy corpsman. Now, squarely in the middle of a pandemic, you're getting ready to start medical school in about a week, as I understand it. So you'll be in medical school, even though you grew up in Ireland. You immigrated when you were a younger man and enlisted into the military and are now a United States citizen, getting ready to start medical school, which is very cool. You have a family and some children, very sweet children and wife that I know well. And I wanted to talk to you a little bit today to get your perspective, Jon Clarke, on where we are as a country and where in particular you are as an entering medical student right here in the United States, right in the middle of what is proving to be a dramatic surge in the first wave of what never ended as a wave of the coronavirus pandemic. And also how this pandemic is not just affecting you and your family and your plans for medical school, but how it's affecting others in our country, from the disenfranchised that may be homeless, or the minorities that may be just getting by paycheck to paycheck and don't have a job now, or the growing population of people with substance use disorders who are both threatened by diseases of despair, amplified and exaggerated and exacerbated by the pandemic, but also by recent efforts by the federal government, the White House in particular, to dismantle the Affordable Care Act, which is a safety net for over 1 million people with substance use disorders who are being treated. So, Jon, if you could get me started in understanding you and how you're approaching your current situation right now, getting ready to start medical school in a week.
Yes, I mean, there's obviously a lot going on in the world today. There's been, 2020 has been certainly a roller coaster for everyone. I think the pandemic has, it's unbelievable how far-reaching it is, and the different ways that it's affected every facet of life, it seems. Here I'm in Johnson City, Tennessee. I moved away from Florida. So obviously right now Florida is the hot spot, but Tennessee has increasing cases. So for me as a medical student, but also with a family, I have some unique challenges in that I have to start medical school in an online format, which is obviously atypical. It's the first time this has ever been done anywhere, where medical schools have had to rearrange things to do, through Zoom meetings and things like that. We'll still be, have that one-on-one with a professor, but from home. For me, I have unique challenges in that I have children, and where do I go to study for 8 hours a day when there's a 3 and a 6-year-old banging on the door? That's, unique challenges there. But yeah, indeed. I mean, when you look at the bigger picture, that's just how it affects me personally today. But I think it's an excellent time to be going into medicine. It's an exciting time to go into medicine because we can see through an epidemic and a pandemic like this how there's just so much need for effective, compassionate care, but also innovation. I think that's a big part of becoming a physician is moving research further along the line and what better time? There's a lot of people I know, I've spoken to classmates who, my particular medical school, they have you can do a master's in public health at MPH alongside your MD. They have that option. Me, I will not be doing that because I'll have enough on my plate. But I've spoken to certain classmates who this pandemic has inspired them. They would never have thought of going into public health, but seeing the effect of it, it's inspired them to get their MPH alongside their MD. Yeah, so it's definitely a weird time, but I think it's a good time to go into medicine, but it's also an uncertain time as well.
I know your decision to go into medical school evolved over the last few years, particularly after getting out of the military after 5 years of serving, and then actually working in a practice for a few years with orthopedic spine surgeon. That would be me. And early on, your thoughts were to perhaps be a physician assistant, and you've evolved into the picture that you're in now, which is entering medical school. And I know that you had great interest in emergency medicine of late in particular. Has this pandemic changed that at all? Because emergency medicine is certainly the front line of front lines, besides the intensive care unit, where, of course, you have a brother who's working as a physician up north.
That's right.
Has this pandemic changed your decision-making for what career you think you will wind up in? What specialty you think you'll wind up in, Jon?
To be frank, I have emergency medicine I've always been drawn to that because I worked in an ER for 2 years in the military, and then I served alongside the Marine Infantry Battalion, and that's I enjoy that aspect of medicine. I'm friends with some old ER physicians in the Navy on Facebook, and I've seen the effect it's had on them. I know one physician in particular basically set up camp in his basement away from his family, and just completely quarantined himself from his family because he was, kind of potentially being exposed to COVID-19 on a daily basis. So I think it's a scary time to be an ER physician. But I don't think that's deterred me, to be honest. I think I'd still be more than willing to I don't know, being on the front line. I'd be proud to be on the front line. I mean, I think obviously I still have a long way before I'm a practicing physician. I'm just beginning medical school, but I'm sure COVID will be gone in 4 years' time, we would hope. But no, I don't think it's deterred me in any which way.
What will not be gone in 4 years is the opioid crisis and the polysubstance use crisis that the country continues to face, and we know is exacerbated by the pandemic. It falls under the diseases of isolation and the diseases of despair.
Right.
And you have some experience in that in your college education. And how do you see the country dealing with the spiking, not just in coronavirus cases, but in rates of suicide and rates of substance use disorders, and unfortunately in rates of death by overdose, and not just with opioids, but cocaine and methamphetamine are also spiking across the country, often in combination.
Right. So my undergraduate degree was in human services addiction studies. So addiction and how it affects people it's affected members of my family personally, but also it's just an area of study that I have a heart for. And I do think, we look at the entire globe, essentially, in lockdown, people who relied on their daily AA meetings, who were in that kind of fragile state of recovery, all of a sudden, can I go to an AA meeting? Is it safe to go to an AA meeting? the therapists had to all of a sudden figure out, yes, they were approved to do telemedicine, but maybe that wasn't available to everyone. And similarly, we all can attest to the fact that there is something about a face-to-face meeting where you can connect in a much more legitimate way than through a Zoom call or whatever, especially if you're kind of hanging on to your sobriety. So I think the effects of COVID on substance use is I don't think the opioid epidemic was live and well in 2019, beginning 2020, and I think sadly it would be fair to expect that the lasting effects of this pandemic on substance use disorders is going to be pretty profound. We see liquor store sales soaring. People are stuck at home, working from home, and I think a lot of people would have turned to, even if it's just out of boredom. There's been plenty of idle time where people have. I think we're going to see new cases of people will emerge from this with a substance misuse or use disorder. And then to speak to like you said, the diseases of despair. It's somewhat. Let's put someone with a substance use disorder aside. Just someone who battles depression. All of a sudden, you're isolated, right? You're disadvised from seeing certain family members. It's far-reaching, and I think if you look at some of the statistics and what the experts feared at the beginning of this pandemic is starting to come through in the statistics, that there is an increase in overdoses, there is an increase in suicide rates, and I don't think that's going away either.
You're going to be wearing two hats for the rest of your life now. One as a parent and one as a physician, covering up that pretty cute do you have going right now, by the way. So those hats that you wear will be needed and important so that you can be a parent and help guide your children away from the troubles that come with substance use, misuse, and then also with your patients, where you'll be called upon, as you have been already as a healthcare provider now, literally for 10 years, you've been a healthcare provider, to help those that are in trouble, whether it's in the military with PTSD, substance use disorders, mental health disorders, or working on the outside in a surgical practice for 5 years, hands-on as a surgical assistant, as you've been now for years, and in the office as a healthcare provider using your Navy corpsman skills. How do you see this combination of an intersection of the pandemic, substance use disorders, and mental health problems coming out of this? And how can you help guide parents to know how to keep their young ones, and like your young ones, or maybe preteens, from falling into the traps that once those talons of addiction get their claws in a young person, it's hard to pull them out, as you know.
Right.
What is your message, both as a parent for your own children and as a medical student and eventual doctor? You have a lot on your shoulders right now.
Yeah, I think the best way to, let me speak firstly as a parent. You learn very quickly that the best way to guide a child is through your own actions, not by just lectures. Lectures don't work with us, especially a 3 and a 6-year-old, So I think there's really pragmatic ways that parents can emulate good behavior that will hopefully take seed in our children. For me, it's simple as if I'm out to dinner with my wife and children And if I have a beer, my children see me drinking a beer. They don't even know really what alcohol is, but I make sure my wife drives, just to try and, again, through leading by example. Okay, when you have a beer, someone else drives. You know, it's little things like that. Now going into, as they get older and more aware, I think not being afraid to address substance use in a very straightforward way. You can't beat around the bush. Letting children know as they grow up that it is a real problem. I think there's maybe a misconception that if you're, affluent and you just have your drinking habits, or I don't know, there's certain stigmas attached to, you assume someone with a substance use disorder is the crackhead on the street corner. But I rather teaching our children that no, substance use and misuse disorders affects everyone, and everyone can fall victim to it, ourselves included. So continually just being vigilant, being aware that we can, it can affect anyone, or regardless of socioeconomic status, or I think that's kind of addressing it in a straightforward way is important. As a physician, as a future physician, I think understanding the human aspect of a patient, not just seeing a patient as someone with an illness, but also taking into account all of the social influences that are affecting them, and seeing them as a whole in a kind of in a holistic way, I think is going to be really important to identify that, you have to get to the root of an individual's problem, not just treat the liver disease, but also see the reason for the liver disease is perhaps alcohol misuse and things like that. So I think my unique undergraduate education and personal life experience and seeing how addiction affects others will hopefully enable me to be a better physician, to see how these epidemics that we're seeing intersect medicine in a very real way.
Right now we are in almost mid-July, and we have hit 60,000 cases of COVID a day. There are well over 3 million cases of confirmed COVID in the US, and we know that's going to increase. Dr. Fauci, unfortunately, said that he would not be surprised if we had 100,000 cases per day in the US if this does not turn around. And he's very concerned about that, as are we all. And one of the aspects of controlling this pandemic is to do testing, do contact tracing and isolation, and quarantine those that are both exposed or infected. And Dr. Peter Hotez from Baylor and others have now said that the number of cases are rising so rapidly that our ability to do contact tracing is gone. And in the United States, that's true. And in Florida, from our experience in Palm Beach County, contact tracing is essentially gone. And it's been gone since we hit 9,500 cases in a day 2 weeks ago. And there aren't even remotely enough people to do contact tracing. Where do you see you and your family falling into this need to protect yourselves and your other family members and friends from an exceedingly contagious virus?
Yeah, I think it's understandable why a lot of people have kind of become fatigued from the guidelines that have been set in place that have been proven to work. The social distancing, wearing a mask, and somehow even wearing a mask has kind of become politicized, and I think that's a real shame. I think remaining vigilant, it's hard. I get it. We all want to go back to life as usual. We're almost 7 months into this pandemic, and I understand the need for people people need to provide for their families and things. And I think there are ways that we can do that sensibly. But for me, it just boils down to being a leader to my family and being a leader to the community. Even if you're the only person at the grocery store still wearing a mask, continue to do it, because what that may do is, cause some realization in or in a few people that, okay, this still is a threat to us. It's not as bad up here in Tennessee. I don't think the cases are near what they are in Palm Beach County, but that's not to say that, Tennessee is a state where the number of cases are still rising. And so I think just trying to lead by example again is really the only thing that we can do, short of getting involved in other ways. I don't know how, but that's how I've tried to approach it, is just try go around my day-to-day business, but still being sensible, still adhering to the social distancing.
We're learning more and more about the risk of aerosols transmitting the disease, not just the larger droplets that can, of course, contain many more viral particles, but tend to drop, thus the name droplet, within about 6 feet or 2 meters, unless somebody's screaming or sneezing. Do you see this evolving recognition that aerosolized particles can transmit the coronavirus to cause infection and COVID-19 as changing anything about what you will say to others to help guide them or do for yourself or your family? You mentioned masks, you mentioned social distancing. Do you see this new information changing anything or evolving even beyond the current CDC recommendations, as you mentioned, for you personally? Can you put on your future thinking hat here and tell us where you think we'll be in a month or two with aerosols, which can fill a room inside and fill a room with viral particles that can cause infection?
Right. Again, if this is the case, if this is the trajectory of how this virus is spread, then we may need to go back to the more extreme quarantine. It's unfortunate to think that we would have to, but I think there are going to be places where businesses do need to shut down again for a time until we can get a better grasp of this, until an immunization is formed. And I know that even there are fears that the vaccine may not be a one and done vaccine, that it may be something that needs to be done kind of alongside your annual flu shot. So yeah, I think we need to be willing to evolve as the virus evolves. I think listening to the science, we have to trust the science and trust the experts that are kind of telling us these things. And I think there's a lot of distrust that's being sown, whether it's through social media or just through through fatigue of all of this, but continuing to listen to the science and having some faith in leadership that we're protecting others.
Yeah, we are learning that being inside is far more risky and dangerous than being outside, and that whether it's with droplets or aerosols or just allowing the breeze to dilute the concentration of viral particles. Obviously, common sense would dictate that a breeze is better than the still air of a room.
Right.
And that maybe you'll be having your medical school classes outside. I can't see doing surgery outside. That's a long ways off, but fortunately there's plenty of PPE used inside an operating room.
Right. Yeah, I've actually seen just down the street from me where we moved, I've seen a church move outside. They have it set up where they have chairs socially distanced under a little gazebo, so that they can still hold their services outside. I've even seen, church services in parking lots, kind of like a drive-in movie theater. I've seen that here. So again, that kind of goes back to the willingness to evolve, because I don't believe people still need to put food on the table, right? So just saying we have to go indoors, shut down all businesses indefinitely, that's not viable, and that doesn't have longevity. So yeah, perhaps businesses that can provide a service outdoors should. Obviously, that'll become.
How about school? You've got young ones. You're right now, I'm sure, covered up with this decision making for what to do with your young children,
right,
who are school age, and we're going to be in August pretty soon.
Mm-hmm.
Obviously, school can be outdoors.
It can.
It has been in the past.
Right.
You've been in the military. You've done field medicine. You
right.
realize that we don't have to have air-conditioned rooms
mm-hmm.
to live and learn and take care of business. So,
right.
where you and your family with the question of what you're going to do with your kids in 2 weeks?
Yeah.
4 weeks.
Right. Yeah. No, hey, I think that's a wonderful idea. I think it would be, again, barring weather being so inclement that it could be a hazard, right? Sure, if it's too hot or too cold as we move into the winter months. But yeah, absolutely. Hey, if you can get my kids into school and keep them safe, I'm all for it. They've been home long enough.
You need some quiet time so you can study online at home. Yeah.
Exactly.
Anything else you'd like us to cover today? You've got a lot on your plate.
No, I think we've done it. We've covered a lot. I think there is again, far-reaching, how this has affected us through mental health disorders, addiction, me as a medical student, but the medical profession as a whole. I think it will change the landscape indefinitely, I think. But yeah.
All right, John. Hopefully I can call you back and get some more information right before you start medical school. Maybe once you find out whether your kids are going to be underfoot while you're trying to study anatomy and physiology, or whether they'll be off down the street to school, which for your sake, I hope they're in school.
Me too. For all of our sakes.
All right. Say hello to your wife for me, and we'll talk again. Thanks very much. Jon Clarke, Navy Corpsman, medical student.
All right, Dr. Campbell.
Where the shrimp boats tie up to the pilings. Give me oysters and beer.